Put Your Heart Into It, the HVC podcast centered around educating providers and staff about common clinical scenarios so that we can better treat our patients. Podcasts on this account are meant for educational purposes only and should not be used as a substitute for medical diagnoses or advice. If you have any clinical symptoms or medical questions, please consult a licensed healthcare provider.
Good morning, everyone. I'd like to thank Dr. Bott for the invitation to speak to you this morning, and I'm really excited to talk about why running faster and lifting heavier is good for your health and for longevity. A little bit more about my background. Dr. Bott, as Dr. Bott indicated, I grew up in Michigan as a competitive runner, and that took me to Wake Forest University, where I earned an undergrad degree in health and sports science. And pursuing graduate degrees at A&M, my exercise really took a back seat, and I took a position at Georgia State University in the Department of Kinesiology and Health. And somewhere on this journey, I developed coronary artery disease. And in 2013, as a 48-year-old, I had a procedure done to correct 95% blockage in my LAD and 88% blockage in my circumflex coronary arteries. And this was discovered by me during a run of 17-mile run with my uncle during an ultramarathon. So clearly this was a little disconcerting for me. And so this talk is going to present evidence related to the benefits of exercise in terms of fitness as well as longevity, but it's also a story of me reclaiming my health and my fitness. So we are a sick country, unfortunately. However, the good news is exercise is a powerful tool to modify the risk of death from 6 leading chronic diseases, and can partially modify the outcomes with 2 other chronic diseases. For some, heart disease begins in childhood, and this can progress into adulthood and lead to adverse cardiac events, as you're well aware. So kids need to be physically active. So it's also known that sedentary aging into middle age is associated with decreases in cardiac mass, cardiac strength, and cardiac compliance. And this is going to contribute to a decrease in maximal cardiorespiratory capacity known as VO2 max. However, a landmark study by Ben Levine's group indicated that a 2-year-long study of relatively intense exercise of both low intensity and high intensity reversed these sedentary aging effects on the cardiovascular system. Patients with heart disease, we know, can benefit from low intensity and moderate intensity exercise training. A recent study demonstrates that just 6 months of high intensity interval training can reduce the plaque burden in cardiac patients post angioplasty. So we know that cardiovascular system will deteriorate with age, and also aging is going to have an effect on skeletal muscle mass and strength, and we refer to this as sarcopenia, age-related decrease in muscle mass. But another factor related to this aging issue is what's called a punctuated loss, in which hospitalization due to a orthopedic injury or illness can lead to an accelerated loss in cardiac function as well as skeletal muscle function. And so what do you think is worse for maximal cardiorespiratory fitness, VO2 max? Do you think it's 3 weeks of strict bed rest, or do you think it's 30 years of aging? Bed rest or 30 years of aging? Or abstain. So it's bed rest. Bed rest causes a greater decline in max cardiorespiratory fitness than 30 years of aging. So the gentleman on the left is my uncle that I was running with when I started having symptoms of my coronary ischemia, and he recently completed a ultramarathon in every single state in the US. And He just won his age group in the 100-mile ultramarathon championship in Nevada a couple months ago. How old do you think he is? What age group do you think he ran? 75? 80. Does he look 80 or 75? The gentleman on the left? Maybe the gentleman on the right, maybe. But my uncle is 81 and still doing ultramarathons. So clearly, endurance training has benefited him. The person on the right is 79 years of age, and he's clearly benefiting from strength training. And there are many studies that show the benefits of strength training in terms of increasing muscle mass and strength starting in your 70s and 80s. So Dr. Bott mentioned one of my favorite quotes. This is perhaps my favorite quote related to this topic, and that is, living systems are worn out by inactivity and developed by use. And this was said by Albert Szent-Györgyi, a Nobel laureate in 1937 in physiology or medicine. And as Dr. Bott alluded, Plato basically said the same thing over 2,000 years ago. So why run faster and lift heavier? Well, our cells, our tissues, and our physiological systems can adapt to this stress, to this exercise, and we call this plasticity. And so when we train for endurance, we can transform our bodies into perhaps a world-class marathoner. If you train your body for resistance, you can develop increases in muscle mass called hypertrophy and increase your muscle strength and power. Can you tell this is the same person? This is Ryan Hall, the only American to run under 2:05 in the marathon in his endurance train years. And this is him several years after giving up long distance running and focusing on weight training. So this highlights the remarkable ability of the body to adapt to the stress imposed on it. Another reason to run faster and lift heavier is because it's known to improve your lifespan and health span. So the line on the left corresponds to a decrease in health span that's typically associated with decades of burden related to cardiac disease. So that's going to decrease in general longevity and health span. However, we know exercise training can improve cardiovascular metabolic functions and improve lifespan and health span. So better aerobic fitness equates to improved health outcomes, as shown in this study. So what's shown in this study is cardiorespiratory fitness, maximal cardiorespiratory fitness, that is stratified into quintiles, with one group being also stratified into the top 2% in terms of aerobic fitness. And this was classified or estimated based on metabolic equivalence or METs. And the key findings from the study are that improving aerobic fitness from the lowest quintile to the next fittest quintile dramatically reduces the risk of mortality, from all-cause mortality. And so this highlights the fact that just a little bit of investment in terms of exercise results in dramatic improvements in health. Further increases in aerobic fitness continues to reduce the relative risk of mortality in this particular age group, which is 30 to 49, and this relationship also held for the other age groups. And for the sexes, as well as for different races. So greater strength also equates into greater health outcomes, as indicated in this meta-analysis study that highlighted that higher levels of hand grip strength had a 31% lower risk of death compared to the lower levels of grip strength. Okay, so to understand how exercise training benefits the cardiorespiratory system and results in health improvements, we need to understand basic principles of exercise training. And they include specificity, which is adaptations are unique to the nature of the stimulus. Progressive overload, for an adaptation to occur, the system must be stressed to a greater degree than what it's used to. Reversibility states that once exercise training stops, the adaptations are going to generally revert back to an original state. And rest and recovery states that adequate rest is essential to allow the body to adapt to the training, to repair tissues, and to avoid injury or overtraining. Now, the graph illustrates the basic idea of skeletal muscle being composed of fast and slow twitch muscle fibers, with the far left part of the graph highlighting an inactive or sedentary person. And so in a given muscle, the slow twitch fibers are going to be characterized by high oxidative content and fatigue resistance, and fast twitch fibers, or type 2 fibers, are going to be characterized by low oxidative capacity, high glycolytic capacity, and high fatigability. And so the idea of specificity is highlighted in this graph when the person starts to engage in a low-intensity exercise program. And that low-intensity exercise program is only going to recruit the type 1 slow twitch fibers. And when you do that over time, you're going to see an increase in the mitochondrial content of those type 1 fibers. So the specificity here is that only the fibers that are recruited in this particular low-level intensity exercise is going to adapt. The type 2 fibers are not recruited, so they will not adapt. So progressive overload is highlighted by the fact that when the intensity of the exercise increases, then you're going to be recruiting more type 1 fibers and eventually more type 2 fibers, and you'll eventually see greater adaptations in mitochondrial content. And so as exercise intensity increases, then the volume of muscle increases, and you're gradually going to see the recruitment of greater and greater muscle fibers going from type 1 to type 2 fibers. And so this is important to the idea of running faster and lifting heavier, because the magnitude of the exercise intensity and duration affects the volume of muscle mass being used during the exercise. And this is what's going to impose the stress on the cardiovascular system. So improvements in type 1 and type 2 fibers fatigue resistance is going to result in greater cumulative hemodynamic stress on the cardiovascular system, which is going to result in positive cardiac remodeling. So hormesis is a biological idea that describes how a dose of a stress can result in an optimal amount of response, adaptations, and resilience. And so too little stress results in no response, whereas too much of a stress is going to result in potentially injury or even worse. And so as the job of the exercise science professional is to make sure that the dose of the exercise is in the right range in terms of intensity, duration, and frequency. And so this really fits the expression of what doesn't kill you in the right dose will make you stronger. So aging and chronic disease makes identifying the dose of exercise more challenging and increases the risk for maladaptation and injury. And this stems in part from reduced physiological reserve, chronic inflammation, and diminished repair capacity. So again, the threshold for injury increases and the potential for adaptations will be reduced as the person ages and or has chronic disease. So how do we exercise? So the American College of Sports Medicine, ACSM, is our equivalent to your AMA. And their guidelines for training for aerobic fitness includes any rhythmic activity, such as running, cycling, or swimming. And this activity should be something that you really enjoy, that you can see yourself doing for the rest of your life. So this activity should be performed at least 3 to 5 times per week. and the intensity should be fairly light in the beginning to hard to somewhat hard as you progress. So the duration of this exercise activity should be eventually up to 30 to 60 minutes per week, with a 30 to 60 minutes per session, and totaling 150 minutes of moderate intensity exercise per week, or 75 minutes of vigorous intensity exercise per week, or some combination thereof. Okay, so how do we measure intensity? Duration's relatively easy, frequency's easy, but intensity's a little bit more challenging. And so you can use the 10-point scale to assess a subjective rating of perceived exertion. And this is typically done in a clinical setting. Or you can use a 6 to 20 scale, a Borg scale that's typically used by exercise physiologists. So honestly, the talk test is probably the best way, or one of the best ways, to assess where your intensity is located. And so in general, then a moderate intensity is going to be the equivalent of you being able to talk but not sing. And so higher intensities are going to result in broken speech, or the highest intensity you will not be able to really speak. So wearables in terms of heart rates are really one of the best ways to assess intensity, because they allow for real-time heart rate monitoring, and intensity will be based off of that. So this slide is here to highlight the fact that the ACSM guidelines for aerobic fitness training really should take roughly 1 to 2 months for you to reach those levels in terms of the adequate amount of volume, duration, and intensity. The first 2 months should be gradually building to those levels in order to prevent injury or dropout due to unrealized goals. Okay, so low intensity exercise is equivalent to a heart rate of approximately 50 to 60%, whereas moderate intensity exercise is equivalent to 60 to 70%. And this is typically referred to as zone 2 training. And zone 2 training is commonly recommended to be done 80% of your weekly workout volume. Zone 2 training is at an intensity that maximizes fat oxidation, absolute fat oxidation capacity during your exercise. But it's below a level where you're going to be relying on glucose and lactate accumulation. So the stress here is on the mitochondria and promoting mitochondrial biogenesis and mitochondrial health. So zone 2 training does the following for mitochondrial health and overall function. It stresses the cardiovascular system. You primarily recruit slow twitch or type 1 fibers in which they will adapt. They will mobilize the highest amount of fat as an energetic fuel source. They stress the oxidative capacity of the muscle fibers. They oxidize fat, glucose, and lactate in the mitochondria, improving metabolic flexibility of muscles. And again, it's keeping the glycolytic flux relatively low. So examples of high intensity exercise include the Norwegian 4x4, which is where after proper warm-up, you're going to be doing 4 times 4-minute intervals with 3 minutes of rest in between each. And this is at an intensity of approximately 85% of your max. So this is a very challenging workout. An even higher intensity exercise workout is what's known as Tabata workouts. And these are 8 reps of 20-second intervals where you're having 10 seconds of rest in between each interval, and this is typically done all out or approximately 95% of your max heart rate. So high intensity interval training is equivalent to heart rates between 70 and 95% of the max heart rate, or zones 3, 4, or 5. And this commonly makes up 20% of your weekly training volume, or once per week. And high intensity interval training is going to rely on glycolytic flux and carbohydrate metabolism, where you're going to see significant elevations in blood lactate, and you're not relying on fat oxidation as a primary fuel source. So high intensity interval training results in the following. You are recruiting nearly all of your muscle fiber types and a large volume of your muscle mass, which is going to lead to significant adaptations in this skeletal muscle. It increases the stress and adaptive potential on the cardiovascular system. During the exercise, fat oxidation again is reduced and glycolytic flux increases, causing the increase in accumulation of blood lactate. Lactate is oxidized by cells of the heart, the brain, and type 1 muscle fibers. And contrary to what you may have learned in school, lactate is not a harmful molecule. It's a powerful signaling molecule for muscle and neuronal growth and adaptation. Turning to strength training, ACSM guidelines for strength training should include 8 to 10 major muscle groups, 2 to 3 times per week for a beginner, and for a more advanced training program, could include training up to 6 days per week and targeting 1 to 2 muscles per session. So please note that the load, the sets, the reps, and rest are different depending on the training goals. Also note that the load is very different for beginners versus advanced trainers, and so the idea of progression is very important while strength training to avoid injury. Okay, so the American College of Sports Medicine just released a position statement on strength training. I think it was 2 weeks ago, and this was based on over 130 studies and 30,000 subjects, in which they emphasize the following. So for optimizing strength gains, then the load should be relatively heavy, approximately 80% of your maximal strength for a given muscle group. This should be done in terms of 2 to 3 sets of the exercise, and the exercise should focus on going through the complete joint range of motion. And this should be done at least twice per week. So the highlights for training for muscle growth or muscle hypertrophy, the emphasis is on volume of training. And so this represents a kind of a significant change in the thinking behind muscle hypertrophy. The old school of thought was to try to train high intensity going to failure, and this has been shown not to be necessarily the case. You can achieve increases in muscle mass by training with relatively light loads, but the key here is that the total volume of the load lifted is what's important. So you can do many more reps of light loads, or you can achieve that same high load with fewer reps. And so another point of emphasis in the position statement is on the nature of the lift. And so if you recall, lifting the weight requires the muscle to contract concentrically, lowering the weight requires the muscle to contract eccentrically, and the stress and strain on the muscle is much greater during that eccentric portion, and that appears to be critical for promoting the increase in muscle mass. Okay, so if you're optimizing power, then here the emphasis is on relatively light loads and few reps. And so the emphasis is on in a given training session, the total number of reps should be less than 24. So for example, this could be 4 sets of 5 reps, but these movements are extremely explosive in terms of these types of lifts, which include the snatch or clean and jerk. And so the emphasis here is on intentionality. And so when you're doing these lifts to help prevent injury, then you need to be very focused on what you're going to be doing in that particular lift. Okay, so benefits for strength training, or benefits of strength training. And so this slide is going to give us an overview of the primary benefits, which obviously will include increases in muscle strength, increases in muscle mass, power, muscular endurance. And with all of these changes, they're going to translate into improvements in activities of daily living, as well as balance and gait speed. In addition to these, there are also cellular changes within the muscle. The muscle is the largest repository for blood glucose at rest and during exercise. And so training is going to affect muscle by improving insulin sensitivity, glucose control, lipid metabolism, and reducing vascular inflammation. And all of these are going to contribute to improvements in health. Okay, so what is the training sweet spot according to ACSM? As you can see, they recommend at least performing strength training twice per week and doing aerobic fitness training at least 4 times per week. And so as you see here, you have 3 relatively low intensity or moderate intensity days of exercise, and you have 1 high intensity exercise, and then you have an active recovery day also built into this generic training sweet spot. Okay, so this is a sample of my training sweet spot. And so what I do is a bit more complicated than that previous sample. And so this sample really highlights what I love to do, which is mountain biking. And as you can see in this slide, then mountain biking might take 2 days of the week, whereas I might do indoor cycling another 2 days of the week. So I'm getting 4 days on the bike, but if you notice, the mountain bike days are relatively high intensity days. And so this is 60 minutes or 90 minutes where my heart rate will typically be anywhere from 80 to 90% of my max as an average. So that's a relatively high intensity. And so in order to offset that stress, then additional things that I'm going to do will be cold water immersion on those days. And so typically this is 10 minutes at 50 degrees Fahrenheit, and this helps reduce my stress, the physical stress from that mountain biking workouts. Another good stress reliever that I do is doing yoga. This is going to help with mobility and stress management. And then sauna is an incredible cardiomimetic. It has tremendous benefits on reducing all-cause mortality. And as you can see from this slide, I am essentially getting either actual cardio exercise or a cardiomimetic exercise every day of the week. Okay, and you can see strength training built in there as well. So recovery is just as important as the training. And the following are known to improve recovery from exercise. And so that is optimizing your exercise load in terms of you want to avoid doing too much too soon. You want to avoid overtraining. Another important feature is sleep quality and duration. Nutrition, focusing on protein and total calories. Other critical factors are going to be hydration and electrolytes, and targeted tools such as red light therapy or photobiomodulation and cold water immersion. So injury is generally going to be inevitable when you're exercising as much as I am. And And there are ways to try to facilitate recovery from the injury, as well as doing alternatives to training in order to avoid that punctuated decline or punctuated loss in cardiovascular and skeletal muscle mass and function. So the fundamentals here are going to be focusing on good sleep, good nutrition and hydration. Alternatives to aerobic exercise training are going to include any sort of cross training. So if you're running, you can go swim or get on the bike. Another fantastic way to promote aerobic fitness, as I mentioned, is sauna. And obviously, if you have any sort of orthopedic issues, then swimming is also a good option. So alternatives to strength training, this may surprise you. So besides just doing regular activity, that's avoiding the injury. So again, if you have an upper body injury, then you can still walk. Cross-education and motor imagery training are two things that really enhanced my recovery from my last shoulder injury from a mountain biking crash over the summer. And so cross-education describes the idea where you keep strength training the unaffected or uninjured limb, and that way that will have benefits on the opposite limb. Another idea is this motor imagery training. So while I was lifting weights with one arm, I was visualizing the movement with the affected or injured arm. And studies show that by doing this motor imagery training, you can prevent 50% of the decrease in maximal strength over a couple week period. So a very profound way to maintain your strength. And then injury-specific modalities can include, again, red light therapy, e-stimulation. Those are very effective. So consistent training is critical for reaping the benefits of exercise training. However, 50% of individuals that start aerobic exercise program will stop in their first 6 months. And this is despite knowing the health benefits of the exercise program. So common examples given for dropout include lack of time, injury or soreness, and low motivation to continue the exercise. So in summary, move. Okay, any movement is better than sedentary movement, and that is whether that's strength training or aerobic training. Any type of movement, any type of activity is better than no movement. If the goal is optimal health, move faster and lift heavier. Optimize the dose of exercise for maximal benefit. Be intentional in your training in terms of optimizing that dose of exercise that's going to optimize your adaptations, but also optimize your recovery plan, and certainly listen to your body. There are risks associated with exercise training. Injury is certainly a possibility. And so, again, there are alternatives to the training that can be done, alternatives to the aerobic or strength training programs. And lastly, find an activity that you love to do that could be part of a lifelong exercise prescription. And I consider this exercise hygiene, just like brushing your teeth or washing your hands. We should be exercising every day. It should become part of your daily habits. Okay, I will leave you with this comment made by my son when he saw this image. And I think it's very germane to this conversation and to this topic. And he said, what I see in this image is somebody that can either be moving towards death or running away from their death. And I thought that was quite fitting for this talk. And so thank you for your time and attention. I'm happy to answer any questions. Yes?
Would you recommend splitting up strength and aerobic training? Like, is there any difference in the outcomes if one day you focus on one versus the other?
Yeah, that's a fantastic question. And the research from the 1970s and 1980s indicated the idea that if you're doing concurrent training, then that could potentially impair gains in terms of strength gains or mass gains. But most of the recent research indicates that that's less of a critical issue. Yes?
What is the role of the red cell?
The role of the red light therapy. Oh, that's a great question. So I had one of my students do a white paper on the effects of photobiomodulation or the red light therapy on muscle regeneration and muscle health. And there are a bunch of studies, animal studies as well as human studies, that show that it is promoting mitochondrial health, mitochondrial energy production. And so anecdotally for me, besides increasing blood flow, right? So blood flow is going to heat the area, but that particular wavelength of energy is interacting with heme molecules within our tissues. And red light is one of the wavelengths that can penetrate fairly deep into our tissues. And so anecdotally, what I've noticed is if I do not do red light therapy before or after my hard exercise sessions, my legs will feel heavy and I'll feel fatigued. And so that's my case study, but there is research to support benefits in terms of tissue regeneration, blood flow, and promoting mitochondrial health. Yes, Dr. Bond.
Well, great lecture, Dr. Ingalls. I mean, incredible. But what wearables do you recommend? I mean, without really, promoting. There's so many out there. What do you use? Maybe tell us that.
Okay, so I'm not going to be promoting anyone in particular, but I am a fan of the Garmin products, and I've had my colleagues at Georgia State University do quite a few studies looking at the reliability and the accuracy of Garmin devices, and they are fairly accurate and they are fairly reliable. In terms of heart rate, then a chest strap is going to be superior to the optical sensors in the watch itself, but I compared my optical sensor in the watch compared to the chest strap, and it seemed to match fairly well. And so I know you can choose Apple Watches, Oura Rings, Whoop straps. There's a bunch of different wearable technology, and I think that in terms of the future of medicine and precision medicine, getting that kind of feedback is important for not just the exercise stress, but also the recovery, and being able to use that as an indicator of how well you're recovering, your resiliency, and your ability to continue training. Yes.
Can I start all of this when my kids are in college, or is that too late?
If you look at the images of the strength training person and my uncle started really running in probably his 40s or 50s, and so he looks like he's 50. His orthopedic doctor tells him he has knees of a 30-year-old, which is kind of unbelievable considering he will run multiple 100-mile races per year. And again, if he's not the first, he's one of the few who have run an ultramarathon in every single state in the United States, which is extremely impressive. And then the image of the other person, clearly many studies supporting the idea that you can start an exercise program at any age, middle age, older age, and you can reap benefits from it.
So
Yes.
a lot of this sounds very complicated for the typical patient. Would you recommend trying to do this at home, or can you achieve the same goal by not paying a bunch of money to a bunch of people to achieve the same thing?
Yeah, so it depends on the goal, right? So if your goal is to improve cardiorespiratory fitness, aerobic fitness, then those things can certainly be done at home, and you don't need to go to a gym and pay gym memberships for that. However, if your goal is to increase your skeletal muscle mass, strength, power, then this is where the risk of injury comes in. And so lifting heavy weight, if you're not trained in proper technique, breathing technique, body position, then you're going to increase the risk of injury. So in that case, I would recommend being trained by a personal trainer, strength and conditioning coach that knows proper lifting technique, that can cue you properly while you're learning these techniques. And so this is a great question, because in the beginning, in particular, any strength training program, you should be probably starting with, if you've never done resistance training, a good place to start is resistance bands, just those rubber bands. That's a good starting point if you're sedentary. Then you can progress up to body weight activity. So body weight squats and push-ups and pull-ups are a good way. You can then harness those rubber straps. If you're trying to do a pull-up, you can use that as an assist. So there's a lot of good ways where you can start a strength training program on your own by just using the resistance bands and by doing body weight exercise. But if you're doing squats, body weight squats can still hurt you if you're getting lazy with your head position in your back neutrality. And so having a certified personal trainer or somebody that knows what they're doing, trained in what they're doing, is going to help prevent those possible injuries. Yes?
So along with the exercise, do you make recommendations in terms of macronutrients like protein, and also can you comment on supplements that you recommend or that you help? And if you could talk about peptide therapy.
I can comment a little bit on that. I'm not trained in nutrition, but I have read quite a bit in terms of at least protein requirements. And so if your goal is to start a strength training program and improve muscle mass, then the old recommendation of 0.8 grams per kilogram is really insufficient. And so a better recommendation would probably be at least 1.2 to 1.6. And if you are really getting after it in the gym, or if you're doing a lot of even cardiorespiratory exercise, then up to 2 grams per kilogram. That's hard to get in per day, but that's what the research supports in terms of meeting those daily protein turnover requirements, as well as being able to build the muscle, build the protein. And so that's my protein recommendation, which is based on relatively recent research. As far as supplements, I'm not necessarily going to recommend supplements, but the supplements that I take are going to be, there's a lot of relatively new information about creatine phosphate. And so historically, athletes use creatine phosphate to enhance their exercise, their interval workouts. And by doing that, they basically were able to work more in a given session. So over time, they improved muscle mass, muscle strength, muscular endurance. It does not increase peak power. It improves your ability to maintain peak power over time. And so the recent findings with creatine phosphate is that it also has significant effects on cognition and brain function. And so now the recommendations, there are all sorts of loading guides related to creatine phosphate. You essentially get roughly 2 grams of creatine just by eating a regular meal. And so the general recommendation is 5 to 10 is kind of a maintenance dose for creatine phosphate, but I've seen up to 20. And up to 20, you might be getting a little GI issue. And so creatine phosphate is something that I take every day. Another thing I take every day is N-acetylcysteine, so NAC. I will occasionally take ashwagandha or quercetin. Ubiquinol is in my daily regimen. And so those are besides a multivitamin, those are my primary supplements. And I'm using, in order to meet those protein guidelines, I am doing protein shakes protein powder to meet that. In terms of peptides, I don't know as much about peptides as the actual exercise programs. I know that there is research indicating that they can be beneficial in terms of promoting gut health and recovery and repair, but that's all I'm going to say about the peptides. I think it's a promising area.
Thanks for listening. Tune in next time for another cardiology-focused episode.